are confused about your weight, if you have questions about weight medications, if you want medically based answers to your questions, you're in the right place. Welcome. I'm Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is important because I actually prescribe these medications to patients. I talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So welcome. Today I am doing another Ask Me Anything. If you have questions after this, you can definitely leave them in the comments. I'm going to post this on the YouTube page and you can leave questions there. I love hearing all your questions. They are all very amazing and interesting, and I love answering them. So feel free to leave them. And as a side note, I can't answer personal medical questions. So if your question's leaning a little personal, I'm going to adjust a little bit so it's more educational and broadly appropriate. Okay, so let's get started. The first question today is about a question about Mounjaro. Actually, I think most of these questions are about Mounjaro today, or tirzepatide. What about gallbladder removal surgery? Can you get pancreatitis from gallstones that have since been removed? Excellent question. Yeah, you could. So if you take the gallbladder out, you're removing the source, the source of the gallstones. But if you had a gallstone that had left the gallbladder and was on its way to the intestines, what happens is basically when gallstones are on their way, they can irritate the pancreas as they're moving towards the intestines. So not all the time, but that is sometimes how you can get pancreatitis from gallstones. And so if you still had a gallstone in the biliary tree, that could definitely happen. The GLP-1 agonists, which I would include Mounjaro in, it's GLP-1 and GIP agonist. You can get, theoretically, you can get pancreatitis from the medication. Most of these studies, I mean, it's rare. Most of these studies were done with the earlier versions of the GLP-1 agonists in patients with diabetes. But it's a risk. It's quite rare, but it is a risk. And so we can generalize that to the broader category because it is such a severe condition and can be so serious. So the medication itself could cause pancreatitis, but also anytime you lose weight, of course, that can cause gallstones, and the gallstones can cause pancreatitis. And then, yes, you're absolutely correct. If you still had a gallstone hanging out in the biliary tree, that could cause pancreatitis as well. Great point. Great question. Next question. All right. Why, this is in regards to Mounjaro, why is there burping? Yes, that is very irritating to many people who have that as a side effect from any of the GLP-1 agonists. So you can get, because the medications slow the movement of food through the stomach, the food is there for longer in the stomach. So there's more chance for reflux, more of a chance for the, partially digested food to move up into the esophagus. And there's more chance of, for people to get burping too. So that can happen. You might experiment with what you're eating as well to see if that makes a difference. Some people have burping that's very related to, and this can go for any of the side effects, very related to when they do their injection. So some people know, okay, a day after I do my injection, I get really tired, or that's when I get the burping, or that's when I, really feel nauseous. So I would pay attention to that as well. But yes, why is there burping? For some people, that is a very annoying side effect. Okay, and next question. Okay, this Okay, somebody is saying, day 3 of my first 2.5 dose of Mounjaro. There's severe stomach discomfort, vomiting, diarrhea, belching, no appetite, feeling full, and fatigue. That can definitely happen for a lot of people. If this as a side note, anybody who's having really severe side effects, definitely contact your physician and make sure they're keeping an eye on you and your progress, because these things, sometimes they don't go away. Sometimes every once in a while I'm talking to somebody and they're like, I have had 2 bites of food for the last 3 days. Like, nobody wants that to happen. So you do need to be monitored. These are, prescription medications. So you do need to be monitored. But yes, reach out to your physician. Stomach discomfort, vomiting, diarrhea, belching, decreased appetite, and fatigue. That's unfortunately pretty standard for many people. It might go away. End of the week, somebody might feel a lot better if they started out the week having that. That might be somebody who, their first 2 days are really bad, but then it goes away, or it might persist and you might decide, hey, this is not the medication for me. Or, it could be bad for the first 2 weeks and then fine. So that's what I think is hard about these medications, is they are quite unpredictable and they really span the gamut in terms of how much they're affecting somebody's quality of life. So you might be taking it and your family member's taking it and they're having no problems and you're having all the problems. And so it's pretty varied. For anybody who is going through those side effects, definitely reach out to your physician if they're really severe. And the ones we talked about are unfortunately not uncommon, but sometimes they do go away. Next question. Okay, this is somebody who's on Mounjaro at the lowest dose. Fine at first, but then stomach is rumbling and feeling bubbly all the time. Vomiting, diarrhea, constipation, heartburn, and feeling dehydrated. Yeah. So, also they're asking, is this a point where Zofran would help? So just in general, so I would say a lot of those side effects are similar to the previous question. And of course, if they're severe, if you're not eating, you really need to talk to your physician. You also, really need to make sure you're able to stay hydrated. Not just are you eating, but are you drinking water? That's really, really important, because also these medications can really irritate your kidney if you're not properly hydrated. So both of those are very important. And then, if somebody, there's lots of things that your physician can do if you are having side effects. We have a lot of medications to help. And whether somebody, sometimes we just need them to kind of get people through a rough patch and then they're feeling a lot better and they're kind of like over the hump. And sometimes we can time it. So it's like day 1 is your Zofran day, or not. If somebody really needs medication to control the side effects all the time and it's not going away, that's always a time to check in and think, is this really achieving the goals that we want to achieve? I have some patients and we're treating the constipation all the time, but it's not difficult for them, and it's not really a problem, and we're monitoring it, but it's not really impacting their quality of life. They'd much rather have some constipation and treat that and be at a lower BMI that's overall healthier for them than not be constipated and have a much higher BMI and have the negative side effects with that. So any medication is a risk of, there's benefits and there's risks. Zofran is definitely something that I use often for patients. It is also one of those medications where if somebody is needing it all the time, that's a good time to check in and see if this is still working for them. So that is a great question, and that is going to do it for today. If you have more questions, please leave them down below. I would love to hear them. And if you want to work with me directly, you can, and I would leave that information down below as well. Thank you so much for watching, and please be well.